In this video, we'll talk about dermatologic skin conditions caused by the sun. First, we have a photosensitivity rash, which can be caused by a couple different medications, the most common being tetracyclines, such as doxycycline. Other ones include thiazides and sulfas. Next, we have sunburns, which can just be treated supportively with cool compress and NSAIDs. But if it's a severe sunburn, then you want to hospitalize the patient, start IV fluids, and do wound care. If you're going to be outside for a while, make sure you use SPF greater than 30. And if you're in the water, make sure you're applying sunscreen every 2 hours or so and reapply after you're out of the water as well. In babies, less than 6 months should avoid direct sunlight just since their skin is more delicate. I've talked about melanoma in another video, but it's important to remember the BRAF mutation and then the drug vermorfinib, which is a BRAF inhibitor and can increase survival in patients. You can get ocular melanoma. If it's small, like 1 to 3 millimeters, you can just do close follow-up. But if it's large and it's symptomatic to the patient, then you want to do radiation. And you only want to do enucleation if the tumor is super large and it's extending past the sclera. Next, we have photoaging. This will cause wrinkles. It can cause brown spots on your skin, sometimes known as liver spots. Smoking can worsen these wrinkles and symptoms. And the treatment for this is tretinoin, which is just a cream to reduce the wrinkles and those spots. Next, we have melasma, which is primarily seen in pregnant women. You'll get these like small brown wrinkles on their face. Pyogenic Granuloma. This is a capillary proliferation that occurs after trauma. So you're going to see these dome-shaped red papules that'll easily bleed. And this is also very common in pregnant women. Next, we have Porphyria Cutanea Tarda, or known as PCT. So this occurs when you have a deficiency in the uroporphyrin decarboxylase enzyme in the heme pathway. And these patients will present with painful blisters and hyperpigmentation. Common triggers and associations to know with this are hepatitis C, alcohol, and estrogens or OCPs. Treatment for this is phlebotomy, hydroxychloroquine, or interferon alpha. Rosacea is flushing of your face. You can also get telangiectasias. Rosacea can be triggered by spicy foods, alcohol, being emotionally distressed, for example. You can also get eye symptoms, so if that occurs, you can consult ophthalmology. And treatment for this is topical brominidine. If the rosacea becomes more pustular, you can give topical metronidazole. And if the rosacea is more severe or refractory to the treatment, then you can give oral antibiotics.